Dementia. At the end of this session, you will be able to describe dementia, explain the importance of identifying and managing dementia early, identify dementia in primary care, and discuss management of dementia at primary care level. Let's begin by defining what the diagnosis of dementia means. It is always an acquired syndrome where you can identify an obvious deterioration from the previous functioning level of an individual. This way, it can be differentiated from conditions like learning disability. It is a chronic condition. Once the pathological condition of dementia has started, it will be progressive and there will be a continuous deterioration of the patient's condition. The core feature is the impairment of the higher cortical functions. These are called cognitive functions and will affect all the domains of one's daily life. Once the dysfunction interferes with the person's independent functioning level, we can clinically diagnose dementia. The knowledge about this condition is most relevant for today than ever before. As dementia has become more prevalent with advancing age, we are going to see more and more patients in the near future. We are aging faster than any other nation in South Asia with an unexpected growth of older population. It has huge burden on health, social, economic systems as well as on caregivers. To make the matters worse, the prevalence of dementia risk factors are on the rise. The exponential growth in older population in Sri Lanka predicted to surpass 1/4 of total population cut off by 2050. We can imagine the dementia crisis that is going to happen in the near future. As stated earlier, we are having one of the fastest growth of older adult population. So, how will the patients with dementia present to medical care? These are the main symptom domains with which the patients can present. Commonest will be the combination of psychological and behavioral symptoms, followed by biological and cognitive symptoms. This table depicts the main clinical manifestation under each domain. You can go through this table. There will be a significant functional impairment in these patients in many aspects of their lives. The cognitive impairment as well as the behavioral and psychological symptoms will contribute to this. When we clinically suspect a patient to have dementia, we need to exclude the possible mimickers of the condition. Depression will be a main differential diagnosis as there can be cognitive impairments due to depression itself. Delirium also mimics dementia due to associated cognitive deficits of the condition and the behavioral disturbances. In mild cognitive impairment, the cognitive deficits will not interfere with the independency of the patient. The presence of layering disability can create a dementia-like picture by interfering with the assessment. Careful exclusion of the possible differential diagnosis is essential. You can see the prominent features of these other conditions which can be used to differentiate these clinical conditions from dementia. Especially in depression, there will be prominent depressive symptoms like low mood, lack of energy, reduced motivation, and inability to feel pleasure. In delirium, the patient will present with acute conventional state where his or her consciousness is impaired and fluctuating. However, we must not forget that any complex comorbidity between these conditions is a high possibility in old age. Once we have detected the presence of dementia, we need to think about the possible types of dementia. The progression, treatment, and the prognosis will depend on the type of dementia. This slide will briefly outline the main features of common dementia types. Alzheimer's is the commonest type followed by vascular dementia. Dementia with Lewy body and frontotemporal dementia have some distinguishing features as well. Vascular and Alzheimer's mixed type is also common in clinical practice. However, in real clinical setup, this differentiation can be difficult. Apart from those common types, there are a few rare types as well. Some will have very discrete features. More importantly, there can be some reversible causes for dementias. Those can be the sole cause or can be contributing to the clinical picture. Detecting those will be of paramount importance as we can treat the cause. So always remember to look for the potentially reversible causes. We should look of the associated features of the potential causes. Normal pressure, hydrocephalus, severe anemia, vitamin deficiencies, endocrine causes are among important causes. In clinical setup, this knowledge should be applied in a systematic way. Once an issue with a cognitive function is detected, the diagnostic evaluation needs to be carried out. A comprehensive history is a fundamental component to begin with. Where possible, a collateral history is essential. We need to inquire about all the points we've discussed so far. After that, some specific information need to be evaluated. Functional capacity, safety issues, legal and financial affairs, elders' abuse, caregiver burden, and available support systems are among the required specific information. Thorough physical examination is a must in any patient with cognitive impairment. We need to look for features of potential causes and features of types of dementia while paying attention to the current health of the patient. Cognitive assessment is an important step in the evaluation. We can use mini mental state examination and Montreal cognitive assessment as screening tools. There are other numerous neuropsychological tests for further evaluation. Baseline investigations should aim at detecting any correctable contributory causes and current physical health. Other specific tests will depend on the individual case. Neuroimaging will help in supporting the diagnosis and management. You can see the English version of mini mental state examination in this slide. A Sinhala version of the mini mental state examination is also available. There are Sinhala and English versions of Montreal Cognitive Assessment Tool. Sinhala and English versions of the Montreal Cognitive Assessment Tool are also available. You may click on this link to view the video demonstrating how to perform the mini mental state examination. You can watch this short video about using Montreal Cognitive Assessment Tool.